Hello, this training is going to be to discuss CWI's Infectious Disease Exposure Plan for 2021. The training will be presented by April Boucher, Director of Quality Assurance, and Chrissy Lewis, Property and Procurement Administrator. In May of 2021, Governor Cuomo signed the New York Health and Essentials Rights Act, otherwise known as the New York HERO Act, into law. The purpose of the New York HERO Act is to protect employees against exposure disease during future airborne infectious disease outbreaks similar to COVID-19. The purpose of this plan is for it to apply to all employees at CWI as defined by New York State HERO Act. Individuals working for staffing agencies, contractors, or subcontractors on behalf of CWI at any individual work site, as well as any other individual delivering goods or transporting people to or from our work sites on behalf of the employer, also need to abide by this plan. There are several responsibilities that come along with the exposure plan. This plan applies to all employees of community work and independence at all work sites, whether it's a work location or out in the community. This plan requires commitment to ensure compliance with all plan elements aimed at preventing the spread of infectious disease. All CWI frontline supervisors, directors, and senior directors are designated to enforce compliance with the plan. This plan will be monitored by CWI's Health and Safety Committee. Necessary adjustments will be made periodically upon activation of this plan and as often as needed to keep up to date with current requirements. The plan will be reviewed and revised and will be documented with a review date as a footer to the plan. Employees should report any questions or concerns with the implementation of this plan to CWI's Director of Human Resources, Director of Quality Assurance, or Property and Procurement Administrator. You can also reach out to your frontline supervisor as well. Individuals may not be aware that they have the infectious disease and are vulnerable to spread it to others. Employees should remember the following exposure controls during an outbreak. Maintain physical distancing, coughing and sneezing etiquette, wearing appropriate PPE, limiting what you touch, no handshaking or hugging, washing and sanitizing hands frequently. Stay-at-home policy. If an employee develops symptoms of the infectious disease, it's important for the employee to not be in the workplace. The employee should inform his or her supervisor about the illness so that contact can be made with the local health department to ensure that we're following the New York State Department of Health and CDC guidance regarding receiving medical care and any necessary isolation. Health screening. Employees will be screened for symptoms of the infectious disease at the beginning of their shift. Employees will self-monitor throughout their shift and report any new or emerging signs and symptoms to the infectious disease to the designated contact. An employee showing signs and symptoms of the disease should be removed from the workplace and should contact their healthcare provider for instructions. Face coverings. To protect your coworkers, employees will wear face coverings throughout their workday to the greatest extent possible. Face coverings and physical distancing will be used together whenever possible. As a reminder, face coverings must cover the nose and mouth. They must fit snugly but comfortably against the face. We would like to eliminate face coverings themselves from creating a hazard such as fogging up eyewear. The face coverings must be kept clean and sanitary and changed when soiled, contaminated, or damaged. Each work location will have extra face coverings available. Physical distancing. Physical distancing will be followed as much as feasible. We want to avoid unnecessary gatherings and maintain a distance of at least 6 feet. We want to use face coverings when physical distancing cannot be maintained. In situations where prolonged close contact with other individuals is likely, we'll be discussing other control methods that will be used that align with OPWDD guidelines. We will be restricting and limiting customer or visitor entry to all locations. Some examples of exposure controls that will be considered during an outbreak for limiting visitor entry will include limiting occupancy at all locations, implementation of physical barriers, delivering services remotely, utilization of floor markings indicating one-way traffic or social distancing, holding meetings remotely, reconfiguring workspaces, restricting travel, use of signage, working remotely, preventing gatherings, elimination of group dining, and staggering of work hours. Hand hygiene is another exposure control that will be implemented during an outbreak. To prevent the spread of an infection, employees should wash hands with soap and water for at least 20 seconds or use a hand sanitizer with at least 60% alcohol to clean hands before and after touching your eyes, nose, or mouth, touching your mask, entering and leaving a public space, touching an item or surface that may be frequently touched by other people. And it's important to remember, when your hands are soiled, use soap and water rather than using hand sanitizer. Respiratory etiquette. When coughing or sneezing, cover your nose and mouth, utilizing a tissue. If a tissue is not available, utilize the upper part of your arm or sleeve and wash your hands immediately following. We would like to point out that there are special accommodations available for individuals with added risk factors. Some employees, due to age, underlying health conditions, or other factors, may be at increased risk of severe illness if infected. Please inform your supervisor or the HR department if you fall within this group and need an accommodation.
Advanced controls during an outbreak. For activities where the minimum controls alone will not provide sufficient protection for employees, additional controls from the following hierarchy may be necessary. Elimination. Employers should consider the temporary suspension or elimination of risky activities where adequate controls could not provide sufficient protection for employees. Engineering controls. General ventilation. Avoid air recirculation. Utilize air filters with minimum efficiency reporting value, MERV 13 or higher. If fans are used, arrange so that the air does not blow directly from one worker to another. Remove personal fans. The use of air purifiers. Natural ventilation. Open outside windows and doors. Opening windows on one side of the room to let the fresh air in and installing window exhaust fans on the opposite side of the room so that they exhaust air outdoors. This method is appropriate only if air will not blow from one person to another. Engineering controls. Automatic disinfection systems, for example, foggers. Each location should have a fogger. Foggers are used to clean, disinfect, and sanitize high-touch surface areas. Cleanable barriers. This would include glass and plexiglass partitions. Adjust workstations to ensure there's plenty of space in between. The use of markings and signs. Hand washing or sanitizing stations. Administrative controls. Have the appropriate disinfecting procedures in place. Not shaking out soiled laundry. The appropriate employee training. Prioritize job functions and essential employees. Cross-training for critical positions. limited shared workstations, having the appropriate signage, rearrange traffic flow, prohibit communal dining, eliminate sharing of food items, require appointments, increase cleaning per OPWDD, enforce mask wearing for visitors, conduct health assessments. Personal protective equipment, gloves for personal care, gowns, face coverings, no gaiters or bandanas, face shields. Exposure control readiness, maintenance and storage, disinfection methods and schedules, high-touch surfaces, following all OPWDD guidance. Exposure control readiness, maintenance, and storage. Symptomatic employee. If an employee develops symptoms of the infectious disease at work, it is ideal to isolate the area in accordance with guidance issued by the New York State Department of Health or the Center for Disease Control before cleaning and disinfecting the sick employee's work area. If an actual or suspected infectious disease case occurs at work, take the following actions. Instruct the sick individual to wear a face covering and leave the work site and follow NYS DOH CDC guidance. Follow local and state authority guidance to inform impacted individuals. Training and information during a designated outbreak. CWI will inform all employees of the location of this plan, the circumstances that can be activated, the infectious disease standard, employer policies, and employee rights under the HERO Act. When this plan is activated, all personnel will receive training which will cover all elements of this plan. If training during normal work hours is not possible, employees will be compensated for the training time, with pay or time off. Retaliation protections and reporting of any violations. No employer shall discriminate, threaten, retaliate against, or take adverse action against any employee for exercising their rights under this plan, including reporting conduct the employee reasonably believes in good faith violates the plan for airborne infectious disease to their employer, government agencies, or officials, or for refusing to work where an employee reasonably believes in good faith that such work exposes him or her, other workers, or the public to an unreasonable risk of exposure, provided the employee, another employee, or representative has notified the employer verbally or in writing, including electronic communication, of the inconsistent working conditions and the employer's failure to cure, or if the employer knew or should have known of the consistent working conditions.
Should you have any questions regarding the content of this plan, please reach to your direct supervisor or April Boucher, Director of Quality Assurance, or Christine Lewis, Property and Procurement Administrator, or Melissa Houghton, Director of Human Resources. A copy of the plan can be located in the Everyone File folder in the Corporate Manual under the Emergency Management section. A copy of the plan is also posted at each CWI location. Thank you for listening.